taking the time to learn more about Impact Health Sharing. I tell all current members and potential members the very first thing you should do is review our guidelines to make sure Impact Health Sharing is right for you and your family. With that, we are doing exactly what Uber, Lyft, Airbnb have done to their respective industries. We're disrupting it, right? And I say that because we're leveraging, like they have, a technology platform. We're connecting someone with a need, in our case, the need to have a medical bill paid, with someone with a want, someone who's wanting to pay less for healthcare. And all that's being done with our technology platform, having that connection occur. So if you're not familiar with healthcare sharing, I can tell you it's been around for decades, formally since the 80s. Not one organization that I'm aware of has ever gone bankrupt. We even are mentioned in the Affordable Care Act. So we even have provisions in there for healthcare sharing. It's designed for the fairly healthy to healthy. What do I mean by that? Here's a staggering statistic when I first heard it. 20% of the United States population are responsible for about 85% of all the medical spend that occurs in this country. Wow. What does that mean? Roughly 80%, 8 out of 10, are really then overpaying for a product or service, in this case, that they rarely use. So Income's healthcare sharing, and specifically Impact Health Sharing, to help save the day and reduce the costs for individuals, for families and small businesses all across this great land. What uniquely separates us from traditional insurance is several things, and what separates us from our good brother and sister healthcare sharing organizations are a few things. And I'm going to get into that right now. First of all, we are the very first healthcare sharing organization to fully implement a sharing process that uniquely separates healthcare sharing from insurance. And it's this distributed reserves concept. Pooled reserves, which is what insurance companies are, right? You're familiar with you or your employer sending a premium into a, kind of a faceless insurance company in the hopes that they'll, pay the medical bill one day. Well, with the distributed reserves concept that we've adopted and endorsed and implemented, being the first, you open your own account. You put money in that account every month. You give us permission to pull money out for the administration, to run the program. And then if you're matched with a medical bill, you have 3 days to accept that process. If you've decided, this community isn't right for you, you can pull your membership, retract it, and whatever monies are still left in your account, we will send you a refund for, right? Unheard of in healthcare, unheard of. And so we're very, very proud to bring this industry first approach. You have full control of your money, you have full access, and for the first time, you're seeing how 100% of all the monies in an organization move. What percentages go to where? This has never been done before, my friends, in healthcare. And we're proud and Impact to provide this type of transparency to you. Some of the other unique features about us is we are the broadest and most welcoming healthcare sharing organization in the country. We are rooted in the love thy neighbor faith ethic. What does that mean? That means we welcome all races, religions, colors, and creeds. And that's just not so with our other good brother and sister organization. You are welcome and encouraged to come into our community with open arms. We are really a decentralized, not-for-profit, peer-to-peer approach. So we have no motivation not to pay your medical bills. We do this in a very efficiently and effective way. In fact, by the time we receive a medical bill, right now we're sending that out in approximately 25 days later. We look at the bill, make sure it's accurate, we discount it, reprice it, and then make sure it's eligible for sharing. And then those payments are processed within 25 days. Why? Again, not for profit, so we have no motive to hang on to those monies. We want you to be seen as a good customer to your doctor and provider. So we're trying to very efficiently, very effectively turn those medical bills around quite efficiently, and we're doing just that. Couple of unique things also. We have an agreement partnership with MD Live. So you have a small ailment that's not serious. You don't need to go to the emergency room. You simply 24/7 from the comfort of your home, you give them a call. You can even video with them, and they can call in a prescription and go get that and treat that illness, all without getting into your vehicle, going to see a doctor, going to an emergency room. All that's avoided. And so we also bring that approach with teletherapy. We're very proud to be the very first healthcare sharing organization to launch and offer this teletherapy benefit. Same concept, right? You're struggling with a mental issue. You need to counsel with a professional from the comfort of your home. You can arrange to do just that. So very unique stuff. What's also unique about us is our prescription drug pricing, right? Industry first, this wholesale pass-through approach. We have yet to see prescription drug prices as low as ours. So you log into the member center and you look in your area to see what those prices are. You decide what pharmacy then you want to go and pay less for. So all these are unique industry offerings with Impact Health Sharing. Membership begins the very first of every month. So you have time to apply for membership, understand what you're applying for. I encourage you to read the guidelines, review those. There are many videos at impacthealthsharing.com that will help you understand what we are and what we're not. And so very unique stuff. Also, I want to close with this. You can see any doctor of your choice. There is no particular network, okay? So all the doctor does is you have your Impact membership card. The instructions are on the back and they send us the bill electronically. We take over from there. It is very, very member-centric, extremely transparent stuff you're not seeing in healthcare until Impact Health Sharing has come along and delivered this great, great value to you. With that, thank you for taking the time to learn more about Impact Health Sharing.